Good morning, everyone, and thanks again to Brian Hart for being our techno wizard to make these Zoom calls happen. I can't help but smile to see faces again and how much I'll be glad to see folks in person, if appropriate, coming up in the month and months ahead, particularly next week as we return to in-person instruction. As my grandmother would say, it's so wise to look up the spigot before the water's turned on. And so we're getting very close to the spigot being turned on and are wanting to do our due diligence and double checking to make sure that our protocols are as safe as possible, that we know what our head count will be, that we have planned to accommodate first and foremost our faculty and staff needs, as well as our high priority addressing of the needs of all of our students. I want to begin with a couple of news notes. Just this morning, I had the privilege to welcome and congratulate the 45 students who have been chosen as our student health ambassadors, funded by the North Carolina Policy Collaboratory grant that we were able to secure in June. These students, and a very diverse group they are, I am proud to say, are being trained today, excuse me, by MAHEC health professionals and by our own faculty in health and wellness. And we'll soon tell you who they are and attach with that a job description of what these students will be doing. We'll be standing on their shoulders as we reopen for in-person instruction, because they will be the most important voice, we believe, in peer-to-peer adherence to the highest health protocols that we've put in place. And so I congratulate them again today, and you'll hear more about that as time goes along here in the next couple of days. And special thanks to Jordan Perry, who is leading the training of those students, and I'm grateful to Jordan for her work. Where do we stand on numbers might be one of the things most important for us to know. First of all, good news. We had all but 2 of our 601 first-time first-year students register for classes, and all but 21 of the 312 transfer students who Lindsay Prather and the great team in admissions have been able to even match, meet, and then exceed the goal of 300 transfer students. Because the great majority of those 2 cohorts are registered for their academic work, we are very hopeful that we will have strong numbers in both of those cohorts. Today, I have also learned that we have approximately, these are Jeff Kuntz's good numbers, 2,400 continuing students. So if you add 2,400 and 300, assuming some of our transfer students will not actually show up, and 601 of our first-time first year, we should be somewhere around 3,300 students as we open our doors for return to in-person instruction. Now remember, a number of those students have opted to be online only, so we may not see them in the coming week or so, but at least that's the number of students that we will serve as our academic mission focuses on a return to the option of in-person instruction modalities. The one worrisome news, numbers-wise, is that we have continued to have a pulling away of students from their residence hall contracts. We had originally hoped that we could have 1,479 students. That's how many were scheduled to live in the halls as of July 13, 1,479. Currently, we've lost 132 of those students who will not be living in the residence halls, for a net loss of approximately 132 students. Bill Haggard and his great team in residence life and student affairs has been tracking this and has also been very aware of helping to keep any student in the residence hall who was open to any kind of accommodations. So I want to give a shout out to that group for their great work. Nancy Yeager, who is a budget person and our leader in student affairs budgetary matters, is projecting that housing revenues will be down approximately $670,000 if the numbers hold as they are today. And her numbers predict that we'll be down about $81,000 in dining. So more on that later. We'll see how things go as we reach census, which I believe is 2 weeks into the start of the semester. So enough on numbers, but they're actually more hopeful for us than I thought we would have at this point, this close to our return to in-person instruction. I have to give a shout out to our faculty and to our staff. Faculty, I have been literally blown away by the way that so many of you have stepped to the plate to customize what you can do to help a student making special requests. I know some of them have been unreasonable. I'm aware of that too. But to all of you who have made special efforts to listen to students, to hear their concerns, and to make adjustments wherever possible, it has been enormously impressive. I've heard many, many stories, and I'm sure there are many more examples of this that I have not heard. To our staff, when I walk around campus with my mask on, I am just, again, blown away by the way that we have accommodated the best-in-class CDC protocols, whether it's social distancing, whether it's the new signs that are up all over campus, whether it's the circles in blue that say, reminder, wear your mask. I think we're all at a place now where we're as ready as we possibly can do and can be, thanks to the incredible help of the campus operations group led by David Todd and our housekeeping staff, both in campus ops and in our residence hall areas. Our housekeeping staff and all of those who have helped to make campus safe are our heroes of the moment. Other heroes of this moment include those on the academic affairs staff who have been helping faculty and students to adjust to this new normal. Lindy, leading CTL, thanks for the tireless hours that you put into this. Lynn Horgan, Regine, Deaver, listening to students together with the advising team like Anne-Marie and C. Riz and others who have listened to students and tried to help students not only adjust and stand up to the moment, but also to accommodate the special needs that a number of our students have. And finally, an additional hero, and one of the reasons we know so much about our numbers is that Sarah Smith and the Student Affairs team has been coordinating all of our parent and student orientation programs. She's come to know so many of the hundreds of these students personally, and she's one of the people who has been giving us some of the best data and also encouraging students to stay enrolled. And so to all of these heroes of the moment, thanks for what you do. There are a number of questions this morning. I'm going to move through them at a pretty quick clip, and then please put in the chat if I'm not clear and we'd like to follow up. There are a number of questions in Kai's area in academic affairs, a very small number today in student affairs, and then I'll be picking up on answering the HR questions of the moment because because Heather Parlier is actually on a call with the system concerning legal issues faced by the system at this point. So let me start with the first question from you. What is the university's plan to provide temperature checking stations in classroom buildings? And what is the official guidance on the threshold temperature for allowing or not allowing a student to attend class in person? These protocols were put together with the advice of CDC, the Department of Health and Human Services in the state, and the World Health Organization by David Weldon and Jay Kutzbach, and Bill Haggard and Heather Parlier have reviewed these. The university will provide temperature screenings for all students, faculty, staff, and any campus visitors who enter university buildings at several locations and times throughout the week. UNC Asheville staff and UNC Asheville student health ambassadors will partner to offer these voluntary temperature checks across the campus. Individuals who register a temperature at 100.4 or above will be asked not to enter the building and to return to their residence hall to self-isolate for the rest of the day as they symptom check and then take a test as needed. They will be instructed to take their temperature again the following day, and if it registers 100.4 or higher, they should contact our student health center, or in the case of our faculty and staff, their medical provider. Notification. How will we know how many cases we have, what the test results are? Will we be notified? How often will we be notified if students, faculty, and staff are diagnosed with COVID-19? How will we receive updates? UNC Asheville has prepared our own public dashboard on COVID-19 positive cases on a weekly basis. We are likely to reveal these cases every Monday or Tuesday morning. We are also working actively with Buncombe County Health and MAHEC on contact tracing, and we'll have a group of contact tracers available on campus following CDC and DHHS guidelines. If you were exposed to someone who tests positive for COVID-19, you will be contacted by one of our campus or MAHEC contact tracers. Our data will include, and I think the form for submission is being prepared by Heather Parlier. It will be a completely confidential form, but all are asked to report if you take a test, what that result was, even if it was neutral and uncertain either way, what the result is, and if you have symptoms. Remember, our mutual community standards and our basic human mutual respect means that each one cares for all others in the way that we follow health protocols. We will also be a part, as every one of the 17 UNC systems will be a part, of reporting our data. We think it's likely to be every 2 weeks on the system dashboard, but we as an institution will report weekly to you. If we find errors in any of our reporting, we will report the errors as well, just so you will know that you can trust what you're seeing there. What is the recommended protocol and suggested cleaning product for cleaning shared copy machines, scanners, and touch screens? Wipes and disinfectant spray and gloves are always available through your contact, your divisional contact to the Emergency Operations Committee. But you may call campus operations at any time, who I'm asking to strive to deliver to you within an hour or two any cleaning supply that you need for any common area cleanliness. We'll hope that that works right away, and we'll ask for some practice on that by those responsible in the next day or so. Number 4, can we take face coverings off if we are outside or socially distanced? Can we once again clarify that masks are to be worn in public places even when the wearer is alone in the public place? Generally, you should wear your mask and socially distance at all times unless you are in your residence hall room or you are in your office and alone. This even means that good protocols suggest wearing your mask outside. Now, if you're walking around campus at 6 in the morning, there's probably not any reason for you to wear your mask, but we would still ask you to mask all the time when you're in any public place, in any form of interaction with anyone, as the best way to protect yourselves, and most importantly, frankly, to protect the resilience of the university to continue our work. Public buildings on campus are now staffing students to check temperatures upon entering. The students have been informed additional PPE, such as face shields, are not necessary. Can you clarify the reasons why a face shield isn't necessary? A mask will suffice in most cases, though we've had no accommodation requests from faculty, staff, or even students not to wear masks for sometimes it's health-related reasons. We would ask that everyone be masked. Because faculty are teaching behind plexiglass, if they wish to have their mask off, they need to have a face shield on. But generally, it is true that a face shield is not as protective of transmission or protective of preventing incoming transmission as a mask would be. So bottom line, the courtesy and the community standards call for masks at all times, and faculty who want to teach behind the plexiglass with face shield can do so, or certainly can wear both a mask and a face shield. Number 6, why have we staffed these positions with students rather than health professionals? The temperature checking stations are staffed by UNCA staff and by student health ambassadors. UNC Asheville, together with the other 5 four-year residential institutions secured a grant through the North Carolina Policy Collaborative that created the COVID-19 Student Health Ambassador Program to engage in peer-to-peer cultural influence so that we do trust and believe in these students, and they will be adequately trained on our campus, but on the other 5 campuses, including Western and Mars Hill, Brevard, Warren Wilson. They will be trained to do this properly. Through this grant, those 45 student ambassadors will also be in close, constant training with our North Carolina Faculty of Health and Wellness and the Health and Counseling Center, plus the MAHEC professionals. If we should have an outbreak on campus, it's MAHEC that will provide a mobile unit for wide-scale testing and also contract tracing to our campus. We owe our pros at MAHEC a great deal of gratitude. They have worked with the 6 of us as presidents and chancellors of the higher educational institutions to ensure that we are not only up to standard, but in many ways we're exceeding even the standards of the CDC. Now, next question. Has the UNC system articulated the criteria for moving to virtual classes? The truthful answer to this is no. I must tell you that every chancellor has been asking for this basically since we presented our plans for reopening for in-person in mid-June. At this point, you know we're going through a presidential shift at the system level, and we will continue to request an answer to this, both one metrically driven and one that will reveal to us what metrics the UNC system will use as they look across the highly varied institutions in the 17 campus system. When I learn it, we will let you know, or when anyone else on the senior staff hears it, we will be sure to let you know. Now for budget matters. Next question was, please describe the 25 to 50% budget cuts submitted to the BOG. I think we provided some information that I hope was helpful last Friday in advance of the the North Carolina Policy Watch release of all of the 17 institutions, projected analysis of the 2 variables, a decline in enrollment in subsequent gradations, and then a decline in the number of budget dollars that we would have and the ways in which we would, given those enrollment scenarios, even consider going all the way to a 50% enrollment drop. You all have now seen what we submitted. Again, I believe that this was a planning exercise. I do not believe there is any need for immediate budgetary cuts at this point, although we will know more at the census point, and we will certainly at that time have another town hall. Throughout this next 2 weeks, we'll be briefing the Faculty Senate Executive Committee, the Staff Council Executive Committee, and the Student Government Association, as well as our own Board of Trustees. So we will keep you posted on that, but I continue to believe that there are a number of operating budget sources that could be reduced before we had to go to any personnel actions. So more on this later, and it is dependent, as always, on our enrollment and on our state appropriation. We will have some idea about that certainly within the next 2 to 4 weeks. Approximately when will we know about the decrease in student enrollment? Is that the day of add drop? The answer is no on that date. We really need to wait for the census date, and I do not know exactly what date that is, but it's certainly in the next 2 to 4 weeks. Would the plans illustrated in the planning document that you submitted go into effect shortly after we know the total increase? Again, this is to be determined, and you will be briefed and brought up to date with what we know and what actions would be taken or considered to be taken as soon as we have those projections in hand. Final question, and there are two questions left for me. Do you anticipate additional support from the state or CARES Act to offset our expected budget deficit? Thanks to the work of the system liaison to the federal process, her name is Elizabeth Mora, M-O-R-R-A. She is keeping us up to date literally many times in a day about the unspent and unallocated existing CARES money for higher education. She's also keeping us up to date on the Democratic platform for the HEROES Act. And now there is a new emerging, maybe bipartisan focused grant allocation that's called the HEALS Act. We're tracking this very, very carefully because UNCA could benefit greatly from these numbers, even though our numbers are smaller in dollars than Chapel Hill or NC State, for example. Because we are one of the minority serving institutions, because of our smaller scale and our distinctive liberal arts and sciences, humanities focused mission, we may have some opportunities to make our case. So we're following this very carefully. Last question to me at this phase. Please update us on the trustee meeting on Friday, July 24th. Our local board of trustees met virtually. The first thing that they wanted to do was provide some kudos, most importantly, to our faculty and staff for the work that we have done to prepare the institution for the return of some of our students. Two particular trustees, Mo Green and Karen Brown, both gave an acknowledgement formally of applause for our faculty and staff and the hard work that they've done. So I want to commend you for all of that on their behalf. I would say each board member is very aware that most of our faculty and staff have not had one day of break since March 13th when we went to online instruction, and they are aware of the sacrifices that you have made. We also have briefed them on the budget matters that we've just discussed, and at that point we were not clear on what Governor Ramsey needed. That became clear, as you know, just several days later, and we responded. I have also alerted them to the need to understand and to embrace the three themes that Provost Campbell is leading us through: COVID and its realities writ large in all of our disciplinary areas, the search for racial justice on our own campus, in our own community, and to serve a broader need at this moment of reckoning to bring down structural racism wherever it exists in our midst. I have also alerted them to the importance of understanding that the election will happen and that our students and our faculty and staff will be involved in discussions about the election, not telling students ever how to vote, but to tell them how to think about this very important election at this time. And finally, I have alerted, in that context of our three themes, I've alerted the trustees that we will be bringing forward, even at our next meeting, which is the end of August, some suggested changes to some of our building names with continued follow-up study by some faculty, students, and staff on these issues, and further change that we hope to see in terms of our own fight against racism in our own midst. So that meeting was, I think, a very full one. It lasted about an hour. To my knowledge, all of our board members were on the meeting, and I'm feeling very supported by the work that they are doing and by how engaged they are at this point. Let me stop there and turn to Provost Campbell to address questions on academic affairs. Kai?
Yes, good morning. There were a number of questions, and I'm just going to try to go through all of these questions in turn. Some people cannot wear masks because they have breathing issues. There are also reports of people claiming breathing issues just to get out of wearing a mask. Does UNCA have an approval process for students who actually have health issues that stop them from wearing masks? Currently, we do not have any faculty, staff, or students who have asked for such an accommodation. If there is a faculty or staff member who believes that they need such an accommodation, we would ask that you contact Christy Williams or Jasmine Taylor in HR at the email hr@unca.edu. Right now, as I said, we have no students that have requested that accommodation, so we should anticipate that every member of our community is adhering to our standards of mask wearing. If this should change, we'll certainly let you know kind of how we're handling it, but right now we don't have any cases of this, and we don't anticipate any cases of this at the current time. When and how do we get plexiglass face shields for in-person instructors? Any faculty member who is teaching in an in-person format who would like a face shield, please be in touch with David Weldon, and we can make sure that faculty get that access to that email address. What's the right email address for David Weldon? But he's the person who will coordinate getting face shields out to anyone who needs them. Can we take our classes outside wherever, whenever we want? Might there be discrepancies about who gets to use outdoor spaces? And could we even have some tinted spaces? We're currently looking into a number of different ways that we can have outdoor spaces. In particular, there's an existing outdoor classroom between Zeiss and the library. Campus operations is looking into adding this to our space management system so that the space can be reservable. That classroom is fully accessible. Campus operations is in the process also of moving furniture from Reuters Center down to the concrete plaza next to Rhodes and to the concrete plaza next to Carmichael. Again, we're looking into making those spaces reservable, and both of those spaces are also accessible spaces. We do have some additional Adirondack chairs that we've ordered and more on order for the quad. And the thought is that we'll be placing those in circles, in small circles, in various places on the quad as needed. I will note that I did have a conversation with some of those in astronomy. We know that at I think about 7 o'clock in the evening, astronomy on some days will be needing that quad, pretty much a very large portion of the quad to do their labs, to be looking up at the sky. So, but prior to that, certainly those spaces will be accessible. We're also looking into making stacks of folding chairs available in some key locations. Unfortunately, I'm told that it has been in the past that has resulted in some missing chairs, but we think that the benefits outweigh the risk. And so we'll share more about how we're planning on handling that as we figure out how to balance security and making those things accessible. One thing I want to note is that music intends to use the covered area outside, but immediately adjacent to Lipinski as part of their practice space. So we want to make sure the community is aware of this because it could impact other outdoor spaces that are nearby. It is the case that some of those spaces that are talked about in the latter case, if I didn't say that they were accessible, it's likely that they're not accessible, but we'll work to figure out the right balance between having those informally available versus having them be reservable. So we're looking into that, and we'll share more about that as quickly as we can. Are we having face-to-face office hours? Certainly office hours can be face-to-face if you have an office that can accommodate meeting in such a way that allows you to continue to maintain the appropriate social distancing, at least 3 feet with a mask. You can also choose to hold in-person office hours in spaces that are not your office, outdoor spaces. I could imagine sometimes where classrooms might be available or other spaces on campus, but it is not a mandate. If you would like to have the opportunity to, or would like to do that, certainly feel free to do so, but you don't have to do your office hours in person. Having some remote office hours might be a great thing. Even if you're inclined to have in-person office hours. Do students have access to or know about how to use the software we're using for remote delivery? Have there been tutorials or workshops offered up? We've not offered up tutorials or summer workshops on the various technologies like Zoom, but it is the case that almost all of the engagement with new students has been through Zoom. So Embark, Advising, all of the ways that we've engaged students to date have used Zoom in some way. And we anticipate that almost all of the returning students have had some familiarity with these tools, if only from the spring or the summer. You know, it's been such a dominant part of how we've been interacting over the last 4 months, just generally. I think that this is not something that we'll have to manage in terms of having special workshops or tutorials on how to use Zoom. But this does connect to another point, and that is, and some of you have already shared, some of the faculty have already shared that you've reached out to students to welcome them back to campus, I think this is extraordinarily important and useful, and I want to encourage everybody, if you haven't already done that, please do reach out to your students. I think, if there are some, that it becomes an opportunity to ask students, how are you doing? Do you have any questions about how to engage using the technology, particularly if your first meeting is going to be online? And we know that students are having, many are excited, many are anxious, many are both. And so a word from you would go certainly a long way in helping to assure students about kind of how they're feeling. And so want to encourage every single person to reach out to their class just to kind of say hello, welcome. When will a decision be made about a possible winter session? There's certainly been some very brief discussion at this point about winter session. We touched on it in the chairs and program directors meeting. And it's clear that we'll need to find a very good way to hear from folks about how they feel about having 1 or 2 winter sessions. It's my hope that we can decide on whether or not we're doing one in December and whether or not we're going to be doing one in January in a time that would allow students to be able to register for courses at the same time that they're registering for spring courses. And so if we kind of back that timeline out, I think we need to know both whether or not we're doing winter session and some sense of the kinds of offerings that we might have, certainly by the end of September, or maybe even mid-September. So we'll have to have those conversations or give you the opportunity to share your sentiments about the potential for winter sessions very soon. Let's see, what space can be used by commuter students who have a mix of online and face-to-face classes? The library really remains one of the best options, and that is true for those who don't have technology necessarily. There's another question about, do we have enough machines to loan to students? We do have machines to loan. At the library, one can check out some machines. But in addition to the library, there are also lots of spaces on campus that students can go. We certainly have Wi-Fi available kind of across the campus and including outside. So if someone has their own machine, they can certainly set up shop in many, many places. We're certainly encouraging students to have headphones so that they can use. The library, as I said, will have loaner machines. They will also have headphones that they will be able to give to students. And we're looking into making sure that we have enough very inexpensive headphones that we can get to students if need be. So we have a number of options. Highsmith is an option, the library is an option, outdoor space is an option. There are certainly some computer labs across the campus that are also options for those who don't have access to their own machines. And so we hope that between all of that, all of those options will give us enough coverage. If I'm meeting with students for 10 to 20 minutes at a time in groups of 1 to 3 outside at a distance of at least 8 feet, do the students and I need to wear masks? I think as Chancellor Cable indicated, we're hoping that folks will continue to wear masks even in those kinds of circumstances. You know, one of the issues that I think we'll face persistently is one of establishing and maintaining the right kind of culture around mask wearing. And so even if, you feel like you are a good distance away, but you're in an environment where you're engaging students, engaging each other, it will be important for us to maintain mask wearing. Again, as Chancellor Cable noted, if you are by yourself in your own office space or personal space, then that is not necessary to wear a mask in your own spaces. But anytime that you're engaging or in a space that is a public space, it'll be important for you to maintain mask wearing. If a student reports COVID-19 related problems, who does the faculty member report to? So first of all, if a student appears with symptoms, indicating that they have symptoms, you certainly would want to ask that student to immediately leave that space and go and be in touch with health and counseling right away. So that includes if they're communicating that they have symptoms to you virtually, via email or in some other, on Zoom, and they are someone who would be potentially on campus or potentially in person, they should reach out and contact their health and counseling service. Of course, if they are off campus and kind of engaging virtually and not expected to be on campus, meaning perhaps all of their classes are online and they're not on campus and not expected to be on campus, then they should see, they're away from campus, certainly encourage them to go see their own health providers. In terms of computer labs, all the keyboards are high-touch surfaces. Who will be responsible for disinfecting those keyboards? We are asking that students, so in the instances where students are coming into computer labs and spaces that are shared spaces, high-touch spaces, we are asking, when we will have wipes available, we are asking students in much the same way that a gym might operate to make sure that they are wiping down their surfaces and that they wipe down both before and ideally after they use a machine, and certainly would encourage them to and want to have them use hand sanitizer, or even better, wash their hands after any use of a high-touch surface. There will be cleaning done in many places that is ongoing for high-touch surfaces. All throughout the day, will be expected to be, there will be folks who will be around, housekeeping will be around cleaning surfaces, but it is not, coming down and sitting at every computer. It is not the case that every computer will be cleaned between every instance of use. And so it is important that students do this. And we think that with the wipes being available, that this is something that can be managed. If a faculty member becomes ill or has household family members who become ill, or if a student in a face-to-face course becomes ill or tests positive, what will happen? What is the process for moving a class online? This is a complicated question, and I've asked all of the chairs and program directors to begin to have conversations about contingency plans. And many of the departments have already, I think all of them you have developed as departments contingency plans in the spring. And partly what I'm asking folks to do is to update those plans and to think about how they would respond. And there's so many parameters, so many variables that it's very difficult to say exactly what will happen in every case. And so I'm asking every department to think about this. And so hopefully all of the faculty will be hearing from their chairs and program directors about development of contingency plans. Will class members and faculty members be notified and need to be tested if someone in a class tests positive? Contact tracing is being done in conjunction with Buncombe County. And when and if there is an issue, you should be expected to be contacted if it is necessary. And so, there are some guidelines around when it becomes necessary to consider someone as being in need of being contacted and getting testing. So one, just by virtue of having someone in the class that has tested positive, it does not necessarily mean that it will not mean that everyone in the class will have to get tested. There will be some questions about the nature and of the kind of contact and the environment that person has been in. And that again will be done with trained contact tracers, and you should expect to hear from folks if there is a need to take additional steps. Is there any consideration of continuing to suspend the limit on the number of W's for a student, and is there a way to extend the deadline for W's, considering that students may encounter COVID-19 related problems? We have actually already moved the deadline for withdrawing to what, as I understand it, to be what the system limit is, and so that is kind of sitting at, it is now in alignment with what all of the other institutions in the system are doing. So that withdrawal date has been shifted a little. I think it's about a little less than a week later than it would normally have been, and that's at about the limit for what the system requires. As for continuing the suspension of the limit, we have not talked about that. We're hopeful that we won't have to do that, but you know, we will certainly be watching that and aware of some of the issues that this, you know, if the semester turns out to demand some reconsideration, we will certainly do that. That's it for the questions, I believe, that were under academic affairs. I know that I ran through them quickly, but I'll hand it over to, I think Bill Haggard is up next with student affairs questions.
Thank you, Kai. Good afternoon, everyone. It is great to see you. And I just lost my questions. There they are. It's great to see you this afternoon. And I just have a few questions this afternoon to address with you. And the first one is there any plan to require a 2-week self-quarantine by students as they arrive on campus, as other colleges are doing? There are some colleges doing a mandatory 2-week quarantine upon arrival. The ones that I know about are colleges that are requiring a 2-week in hotel at the student's own expense quarantine in town. We have decided not to do that because that would be really impact the accessibility of a lot of our students economically. So, but we are requiring a quarantine of international students, and since the number is low enough, we will provide that quarantine for our international students if they're living on campus. The second question is, if we have an outbreak on campus, what is the protocol? This gives me a great opportunity to say, first and foremost, we have an opportunity to prevent an outbreak, and that's our first goal. And as the Chancellor has mentioned earlier, and as Kai has reiterated, if we can get the entire community to buy into all of the protective measures, our face coverings, our social distancing, the hand washing, the symptom checking, the staying home if you're sick, and all of that, that will prevent an outbreak. But in the event of a case, of an individual case, what first happens is the student will be, and they have been in a redundant manner communicated with, to report any symptoms to the Health and Counseling Center. Our students feel good about going there normally, so there's no stigma about that, making that contact with the Health and Counseling Center. So they will first contact the Health and Counseling Center. There'll be a medical provider that checks in with them, asks them questions, and then they'll follow the directions of the medical provider, whether that is testing or whether that is to continue to quarantine and observe symptoms. If testing is required, if there's a positive test, or if there is information of exposure that meets the criteria used by the contact tracers, then there would be quarantine, and then upon a positive test, there would be isolation. The contact tracers will be the ones who will determine who needs to be contacted. And we currently have 72 on-campus spaces in our residence halls designated for quarantine and isolation. Really right now, compared to our UNC system peers, that's the highest percentage of residential spaces, so we feel we're in good shape there. We're continuing to consolidate housing spaces as students continue to cancel their on-campus living as they learn that their entire schedules are online, which has been the number one reason for the last 2 weeks. So we'll continue to consolidate spaces, and we select those spaces based on the security of those spaces and the limited access to those spaces. And in most cases, outdoor entrances to those spaces. So they would be quarantined or isolated on campus, and as soon as those periods of quarantine or isolation are over, they'd be released to go back in their normal living arrangement. So that's our processes for our basic protocols. Obviously, they go into more detail for anybody who believes they have symptoms or have had exposure. If we do all those things and do all those things well, I'm optimistic we can prevent an outbreak. In the unfortunate occurrence of that not happening, and we do have an outbreak, which means we have more cases than we are predicting, and those cases happen in a very concentrated time. We'll be working very closely with the Buncombe County Health Department, our partners at MAHEC, a rapid response team that MAHEC is coordinating for us to assist us in those types of situations, and we would follow their guidance. We've made some initial contacts with off-campus housing opportunities, basically hotels and a couple other options. So we've had preliminary conversations. We're prepared to do that if necessary. Hopefully that will not be necessary if we all do a good job following the protocols. The third and last question in my area is, if we go to virtual classes, are students guaranteed to be able to stay on campus if they desire? So two real answers to that. First of all, right now, those students who are having fully online schedules, many of them are deciding to continue to stay on campus so they can be here on campus. This is the best place for them. And they want to take part in other activities on campus while they're here, even if their schedule is online. So can we guarantee if they can stay on campus if we are, for some reason, directed to go completely online? That decision would be made in conjunction with, in conversation with the system office. We would be following their guidance. It will be our intent to advocate for students' ability to stay on campus if that were to happen, because in the spring, we had a large number of exceptions, of students applied for exceptions, because for many students, staying on this campus is the safest and best option for them. And we want to make sure we can accommodate those students who want to stay here. But ultimately, if we all have to, if all classes have to go online, there will be UNC system guidance on that, just as there was before. But again, last time, the system guidance allowed us to make those exceptions. So we anticipate that will be the same this time, but we can't guarantee that to be the same this time. So those are the answers to my three questions. I just want to reiterate something Kai said that's really important. We've had, as of the end of the day yesterday, we already have over 400 students who have moved in on campus. We have been doing a staggered move-in to reduce the density and to reduce the crowds, and it's gone very well. We've had great feedback from our students and their parents on those processes. So students are back, they're excited, they'll continue to move in today and tomorrow. We've been moving in our first year students this past Sunday, Tuesday, today, and tomorrow. They will all be here tomorrow. Those who plan to live on campus, our first years. Our continuing students will be here Saturday and Sunday. So as Kai said, please reach out to your students, not just faculty, but staff as well. If you have contact with students, they're here. The campus is a little more empty than it normally is at this time of year. So anybody who chooses to reach out and communicate and support their students, it would be very helpful. And I know it would mean a lot to them as they're back, and they're very excited about the start of this semester. So those are my questions, my comments. Thank you very much.
Thank you, Bill. Appreciate all your work. Heather Parlier has been able to join us. She is off the call. So Heather, if you're willing, would you please address some of these HR questions, and I'll weigh in if needed. And if you could share anything that could be made public from the call that you've just had with state officials about the legal issues, if there is anything to share.
Sure. Thank you, Chancellor. And hi, everybody. And I'm sorry I'm joining late. You all have probably seen in the media, and some folks on our campus know that there is an attorney who says he represents faculty and staff, employees of the UNC system, and that he plans to file a lawsuit to prevent the return to campus work. And so we think that that will probably be filed today. That's the information I've just gotten. And that's kind of all we know right now. We don't really know what legal theory he's going to be using to file this lawsuit. So, and I've communicated to some of our faculty and staff leadership, you know, if you're contacted by an attorney, everyone has the right to talk to an attorney if they wish. You also don't have an obligation to do so. So I just wanted that to be clear for everybody. And so we've got some questions that were submitted that are related to human resources, and I thought I would go through those. Because I haven't been on, I can't see any of the chats prior to me getting on the meeting, so I apologize if I'm missing something. So first question has to do with workers' comp and whether if someone contracts COVID through what they believe to be through their work at UNC Asheville, whether they're going to be required to go through the workers' comp process or whether they can take their own sick time. So we do have a workers' comp process on our campus. It's actually a part of the North Carolina state workers' comp process. If you believe that you did become ill and you are entitled to workers' comp due to COVID because of your work on campus, you can absolutely go that route. All of our employees, including temporary employees, have access to sick leave specific to COVID. So if someone tests positive for COVID or has COVID symptoms and needs to not be at work or working, you have access to this special sick leave. You sort of have both options. You know, the workers' comp process is the process. It's external to UNC Asheville. And so I don't know, there would be some sort of analysis of whether you contracted it due to work or you contracted it due to something outside of work. But we do have that sick leave available to everyone. Questions about furloughs, and I think the Chancellor probably talked about this a little bit in her opening remarks and about in answering some questions. But, you know, as we've said in a number of our town halls now, our two main sources of revenue are our state budget appropriations and our enrollment and tuition and fees. I'm sure this has been addressed, you know, our numbers still are pretty good. You know, obviously there's been some melt in housing, a little bit in our enrollment. So we just don't know if furloughs will take place or what the process will look like. As we've said a couple of times, the furlough process is really dictated by both the system office and then also by the state of North Carolina with respect to different types of employees. What our hope is that if we do need to engage in some sort of furlough, that we're able to do it in a way that everyone's treated in a fair and equitable way, ideally through what they did in 2009, the state did, which is everyone minus a certain threshold under a certain income took a percentage of a pay cut for a period of time. That would probably be our preference, but again, we don't know what that will look like and we don't know if we're gonna have to do that or not. And I mentioned this, temporary employees are also entitled to that paid sick leave if it is COVID related, if they have contracted COVID or are having COVID symptoms. And I believe the Chancellor probably answered this, you know, talking about the budget cut exercise, right? It was an exercise. We don't think that 25 or 50% budget cut is something that would happen. But again, we would look we're looking at cutting budget in a lot of different ways, you know, travel, professional affiliations, those sorts of things to help preserve our faculty and staff, you know, roles. And again, furlough might be an option, but we're trying to make sure we would do that in an equitable way. We continue to get, you know, questions about school and caring for dependents. If we've worked closely with the areas where employees don't have the option to telework. If you continue to feel as if you're not getting the answer you need from your supervisor about childcare needs and being flexible with your work arrangement, please do reach out to Human Resources, and we can work that through with you. But we have, we've had a conversation with a number of faculty and staff to try to figure out their own specific situation and what they need in terms of leave or flexibility. And so that's what we are encouraging, that for everyone, to make sure that you are, if you're a supervisor, being flexible and humane and understanding if you have folks in your department or your area that have child or dependent care needs. And if you're not getting that flexibility, please do reach out to HR. And then the last question was about the lawsuit, and I just gave that answer. Again, we think it'll be filed today, and we'll just have to wait and see what it actually says, because we don't know what he's going to put in the complaint. And those are my questions.
Thanks, Heather. I know we're getting close to noon. I'm going to ask that anyone who is available to stay on for at least another 10 or 15 minutes so that we can address any of the questions that came in the chat. Sarah, you've been monitoring that. Are there some that we could address now? And then I'll make a few brief closing remarks.
Yes, thank you, Chancellor. A couple of questions that came in for Provost Campbell. Will the deadline for final grades be extended to November 30th?
Sorry. So we did, I think, look at that, and I'm trying to remember. I did talk with Lynn. I think that suggestion was brought up, and I believe that we have in fact decided that that was okay. I don't know if Lynn is on this in this meeting. I think that we've already done that, but if not, we certainly are aware that that's an issue, a question, making sure that folks have enough time. And I think that there's no issue with that. I will get back to folks with a definitive answer as soon as possible.
Lynn, do you happen to be on the call as well? If you wanted to weigh in, unmute and add. Okay, Lynn, would you like to weigh in here? If you choose.
There we go. Now I can unmute. Okay.
Thank you.
I'm unmuting. Yes, we did talk about that at one point. I didn't know if we finalized that, but I think that would work. We were planning on keeping our regular graduation date, our traditional mid-December degree award date. So extending to the 30th would be fine. Yep. We can make that formal and put it on the calendar.
Thanks, Lynn.
Okay, another question was, what are the specific locations for the temperature checks? Or what are the specific locations for temperature checks?
The senior staff has discussed this, and we believe that our high traffic buildings should be first and foremost. So that would include certainly Ramsey Library. It could include Highsmith Union. It certainly will include the dining hall area. In addition, I think we'll do random checks at different class times, the start of class times in all of our academic buildings, particularly those that have a large number of people coming and going at any one point. So Rhodes Robinson, Carpin, Lipinski, and so on. If you have suggestions or you would like to make sure that some particular area has intermittent temperature checks, we would like to hear that. Please send me that suggestion through Shannon Earl to Kai Campbell and to me.
And then just one other question. Thanks for all the conversation in the chat, by the way, everyone. This question is, what is considered an outbreak?
I asked this question of the system together with my chancellors as we were seeking to know what would prompt or what metrics are you watching to move back to online only. And they are studying it. So what I asked of MAHEC is, what would I say constitutes an outbreak? Are there any CDC guidelines about that? The answer I got from Dr. Jeff Heck as the leader of MAHEC is it relates to capacity, just as it relates to capacity in a hospitalization situation, the number of ventilators, the number of ICU beds, and so on. For us, it really relates to capacity to handle and support the number of, let's say, students who would be testing positive, whether they were in a class or in a wing of a residence hall, and how quickly we can get those students tested and into quarantine or into isolation as is needed, and how quickly we can simultaneously begin the contact tracing. So I don't have a number. I think, Bill, you just said you've reserved 72 beds. Is that the number that you've alighted on, Bill?
Yes, and we anticipate that that will increase as we continue to consolidate some spaces in the next few days.
So I think roughly that number of beds probably equals at least one fair metric for what would constitute an outbreak that would need to be controlled. I take a lot of reassurance in the fact that the rapid response team's notion that all 6 of the 4-year institutions will be using from Mayheck and from Mission Hospital can help us in a moment where the spread might start and move very quickly. So we're going to learn this one as we go, and I'm still hoping to hear some answers from the UNC system about both how they define an outbreak and what would prompt us to move to virtual only. Sarah, any other question you want to raise?
Just one last question that came in really quickly. Are there an expected number of cases this fall?
I have not heard any number of anticipated or expected cases. I know that we have access to many hundreds of tests, but that doesn't equal to the number that would be positive. Does anyone else from the senior staff or Dr. McKay, I see that as one of our heroes, as our physician from Mayheck who helps our health and counseling center staff. Would you have a comment on that if you're still on the line? Dr. McKay, Martha McKay.
Hi, let's see. Yeah, I'm unmuted, thank you. We would be able to calculate that from, say, the last 2 weeks or the last month of the baseline percentage of people in our area who are getting COVID cases. For instance, how many people in Buncombe County tend to have positive tests? But it's a little unrealistic to say how many people in Buncombe County as our rate, because we know our students come from other counties. And that's a very interesting mix. We could probably put a computer model to work on it, but we also don't know how students will do compared to the age group that they're compared in. 18 to 49 is a pretty wide age group, and our students are usually a little smaller age group there. So we don't know that data.
Thanks for being with us, Martha, and for all that you are doing and have been doing since this all descended on us in March. We so appreciate your expertise. Thank you.
Do you mind if I just add one other thing, Chancellor, is that when you look at best practices, so for example, contact tracers, the CDC recommends having 1 contact tracer per 1,000 people. And we have 12 employees who have already gone through, have received a certification for contact tracing, plus Mayheck is supporting us in contact tracing in addition to the health department. So we're well below that threshold. Even if you just count just our 12 employees, we're at approximately 300. Plus we have the additional resources. So it's just another metric to put out there.
Thanks, Heather. Let me provide just, excuse me, let me provide just a couple of finishing comments here. We believe it is wise for us to have a faculty and staff town hall meeting on Tuesday, August 11th from 11:45 to 12:30. I know that gets into common hour times that can sometimes be departmental meetings, but it's at that time that we'll at least have a first pass on who's here, who's not coming, what our numbers look like, as well as to hear back from you about what that first day of return to in-person, in addition to hybrid and online, looks like and is feeling like to you. So please hold Tuesday, August 11 from 11:45 a.m. to 12:30. Another thought, let's continue in our humane instincts to adapt to what happens when we reopen, whether it's in the residence halls, classrooms, library, whatever, that we will continue to see this as a two-way process if there are suggestions that you have, please get them to Heather, to Kai, to me, to Bill Haggard, so that we can be hearing from you and adapting to the needs that arise that hadn't been thought of or planned for. We want to be responsive because, as always, the health and well-being of our faculty and our staff and our students is the single highest priority. So there always be ways we can improve. We continue to communicate frequently and will continue to do so. I want to give a shout out to all of those, especially Sarah Broberg, who participated and led the effort for our virtual commencement for our May 2020. I want to thank the faculty members who came to the quad that hot day 2 weeks ago to be filmed. I also want to give a huge shout out to Melody Galloway, who together with the UNCA singers and Moretta and others sang a revised and frankly very moving, modernized version of our alma mater. So thank you for the work that you spent on that. It was also a great privilege for Provost Campbell and me to meet with Patrice Harris as she was being audio taped for her remarks when we were in Atlanta. She has reasserted to me that she is hoping she'll be able to spend a day or two on campus and is willing to be a visiting lecturer both on COVID and the COVID issues that we've all faced and what she thinks that might mean for long-term healthcare, and also to be a guest lecturer in classes about health equity and the availability of health care to all persons in our nation and around the globe. So I hope that we will afford ourselves of that great privilege to work with her. She is truly exceptional as a leader and a wonderful person to be around. And the last thing, just to take a moment of personal privilege and to give us a moment of levity. I don't ever like to disappear when we have one of these town halls, but today, while I'm sitting at the desk here at the Chancellor's house, a black bear came in the side door of my living room. And so I dashed out so that I could make sure the bear didn't get any further into the living room. And so pardon me for my dashing off, but it's been a moment for a big smile, and I was spared any problem with the bear. This is the guy, we think it's a guy, who's walking all over campus and actually crossed the quad the morning that we were videoing the virtual commencement ceremony. So I hope that brings a smile to all of you in this very difficult time that we're facing. Most importantly, thanks to each and every one of you. I am confident we're doing our best. Let's proceed in that light, and let's be humane and supportive of one another as we get through these coming weeks and welcome our students back. Thanks everybody, and thanks for joining us this morning. Thank you.